Have you been feeling more tired lately? Maybe you wake up after a full night's sleep, but you still feel exhausted. Maybe your hands or feet sometimes feel strange. Or perhaps you've noticed that your memory isn't quite as sharp as it used to be. Many people over 60 simply blame these changes on aging. But sometimes there may be another reason. Your body could be running low on an important vitamin called vitamin B12. Vitamin B12 plays an important role in making healthy red blood cells, supporting the nervous system and helping your body function normally. When B12 levels become too low, the symptoms can develop slowly, which means people may not recognize the problem right away. And that's exactly why today's topic is so important. In this video, we're going to look at 7 warning signs of vitamin B12 deficiency that you should never ignore after 60. But remember, these symptoms don't automatically mean you have a B12 deficiency. Many other health conditions can cause similar problems. The only reliable way to know is to speak with a healthcare professional and, when appropriate, have your B12 level checked. Let's begin with the first warning sign. Do you feel tired even after getting enough sleep? B12 deficiency can contribute to anemia, which means your body may not have enough healthy red blood cells to carry oxygen efficiently. As a result, you may feel unusually weak, tired, or short of breath during activities that used to feel easy. You might notice that climbing stairs leaves you exhausted, or that you need more breaks during the day. Don't automatically assume this is just part of getting older. Persistent or unexplained fatigue deserves attention. The second warning sign involves your nerves. You may feel pins and needles, numbness, burning, or tingling in your hands or feet. B12 is important for maintaining healthy nerve function. When deficiency becomes significant, nerve problems can develop. Some people describe the sensation as if their feet are asleep even when they haven't been sitting in one position. If these sensations keep returning or gradually become worse, talk to your healthcare professional. Never ignore these 7 vitamin B12 deficiency signs. After 60, doctor explains, welcome back. So far, we've covered 4 possible warning signs: unusual tiredness, numbness or tingling, balance problems, and changes in memory or concentration. Now, let's look at 2 more signs that can sometimes appear when vitamin B12 levels become too low: a smooth, sore, or red tongue. Take a moment to think about your tongue. Does it sometimes feel unusually sore, swollen, or sensitive? Have you noticed that your tongue looks smoother or redder than usual? A significant vitamin B12 deficiency can affect the cells that normally maintain the lining of your mouth. This may lead to a condition called glossitis, where the tongue becomes inflamed. Some people describe it as a burning sensation, especially when eating spicy or acidic foods. You may also notice changes in taste or simply feel that your mouth doesn't feel normal. But remember, a sore or red tongue does not automatically mean you are deficient in B12. Other nutritional deficiencies, infections, medications, and medical conditions can cause similar symptoms. That's why persistent changes should be discussed with a healthcare professional rather than treated with supplements based only on a guess. Pale or unusually yellow skin. The 6th warning sign involves your skin. If your skin begins looking noticeably paler than usual, it could sometimes be related to anemia caused by vitamin B12 deficiency. When your body doesn't have enough healthy red blood cells, your normal skin color may appear less vibrant. In some cases of significant B12 deficiency, the skin can also develop a slightly yellow appearance because of changes related to red blood cell breakdown. However, skin color changes have many possible causes. For example, anemia can result from iron deficiency, blood loss, chronic disease, or other nutritional problems. So don't assume that pale or yellowish skin means you need B12 supplements. Instead, think of it as a reason to investigate what is happening inside your body. A simple conversation with your doctor and appropriate blood testing can help identify the real cause. Never ignore these 7 vitamin B12 deficiency signs. After 60, doctor explains, welcome back. We've already covered 6 possible warning signs of vitamin B12 deficiency: unusual tiredness, numbness and tingling, balance problems, memory changes, a sore or smooth tongue, and changes in skin color. Now we come to the 7th and final sign: muscle weakness. Have you noticed that your muscles don't feel as strong as they used to? Maybe getting up from a chair has become harder. Perhaps carrying groceries feels more difficult, or you feel weak when climbing stairs. Muscle weakness can have many causes, especially as we get older. But when vitamin B12 deficiency affects the nervous system, it can contribute to weakness and make normal movement more difficult. This can sometimes happen together with numbness, tingling, or balance problems. That's why a combination of symptoms is particularly important to discuss with your healthcare professional. But there's another question we need to answer. Why can B12 become low after 60? Getting enough B12 isn't always simply about what you eat. Vitamin B12 naturally occurs in foods such as fish, meat, eggs, and dairy products, but your body also needs a healthy digestive system to absorb it properly. As people get older, absorption can sometimes become less efficient. Certain stomach or intestinal conditions can interfere with absorption. Some medications can also affect B12 levels when used for long periods, including certain medicines commonly used for diabetes or acid reflux. People who follow strict vegetarian or vegan diets may also have a higher risk because natural B12 is mainly found in animal-derived foods unless fortified foods or supplements are used. This is why it's important not to guess. If you have several symptoms that concern you, ask your healthcare professional whether checking your B12 level makes sense. And don't start high-dose supplements simply because you recognize yourself in this video. The right treatment depends on the cause and your individual health situation. Never ignore these 7 vitamin B12 deficiency signs. After 60, doctor explains, we've now covered all 7 warning signs that may be associated with vitamin B12 deficiency. Number 1, unusual tiredness. Number 2, numbness or tingling. Number 3, balance or walking problems. Number 4, memory or concentration changes. Number 5, a sore, smooth, or red tongue. Number 6, pale or unusually yellow skin. Number 7, muscle weakness. But here's the most important message. Having one or more of these symptoms does not mean you definitely have a vitamin B12 deficiency. Many different health conditions can cause the same symptoms. That's why trying to diagnose yourself from symptoms alone isn't a good idea. If you're over 60 and you've noticed persistent fatigue, unexplained numbness, balance problems, memory changes, or other symptoms we've discussed, make an appointment with your healthcare professional. They may review your medical history, medications, diet, and symptoms, and decide whether blood testing is appropriate. And remember, B12 deficiency is often treatable once the cause is identified. The treatment may involve improving your diet, using fortified foods, or taking vitamin B12 supplements. Some people may need B12 injections, particularly when their body cannot absorb the vitamin properly. But don't automatically take large doses of supplements just because you think you're deficient. The better approach is simple. Find out what's causing the problem first. Your body often gives you clues when something isn't right. And the key is learning to recognize those clues and taking action instead of dismissing everything as just getting older. After 60, protecting your health isn't about doing everything perfectly. It's about paying attention, eat a balanced diet, stay physically active, keep your medical appointments, take prescribed medications correctly, and talk to your healthcare professional when something changes or doesn't feel normal. If you found this video useful, like this video, subscribe to the channel, and turn on the notification bell for more simple health information for adults over 50. And share this video with someone who may benefit from it. Remember, aging is natural, but persistent changes in your body deserve attention. Listen to your body, ask questions, and take care of your health. Thanks for watching, and we'll see you in the next video.